And welcome, everyone. Welcome to another edition of The Natural Nurse and Dr. Z. I'm Dr. Z, and we're here every week with great information about health, wellness, and alternative medicine today. And you can always get more information about our events and talks and walks and all kinds of things coming up for the summer at naturalnurse.com and drznaturally.com. So we're really excited to have Dr. Stephen Sinatra on the program. He's been on our program before. He may not remember, but yeah, he's been here before, and we're really excited to have him on. He's one of the most highly respected and sought-after cardiologists, and uses integrative approaches to treating cardiovascular disease, even people with very advanced forms of the illness. And he has 40 years of clinical practice, research, and he started his career here in Connecticut, where I'm actually broadcasting from, at Manchester Memorial Hospital. And then he went on to be chief of cardiology and director of medical education and cardiac rehab and director of weight reducing program. And he's the founder of the New England Heart Center. He also has co-authored a lot of books, great books. The Cholesterol Myth, one of my favorites. Reversing Heart Disease Now, Coenzyme Q10 Phenomenon. He was way out in the forefront of CoQ10 with the Life Extension Foundation folks too. Sinatra Solution, Metabolic Cardiology, and also really interesting stuff. I saw Dr. Sinatra at one of the restorative conferences talking about earthing and using the Earth's energy to help with cardiac disease. So he's really looking at new vistas of medicine for us. So without further ado, Dr. Sinatra, welcome to the show.
It's good to be here, Dr. Z, and thanks for such a kind introduction.
Yeah, you're very welcome. So excited. So I want to back up the show.
You're in Connecticut right now, right? You're broadcasting from Connecticut?
Yeah. I live in Connecticut. I'm one of the founders of the Naturopathic College, and I still teach at the college.
Oh, in Bridgeport, you mean?
Bridgeport. Yeah.
Oh, okay, yeah. Great.
So I've been there. I've been with the college since the inception, over 20 years now, and training next generation of naturopathic physicians. And so I've been, also at the forefront of alternative health with the natural nurse too. So it's exciting to have you on and talk about these great things. So I wanted to talk about just general heart disease, and then we can also, do the COVID thing towards the second half of the program, because you have such great depth of knowledge in the heart. And I think there's a lot of information that should be shared with our listeners. So let's talk a little bit about, first of all, your own background. How did you make a jump from a cardiologist that doesn't really use nutrition in their practice and understanding the physiology of how nutrition helps the body into one that does? That's kind of an interesting life story, I'm sure.
Yeah, it is. It is interesting because I was involved in vitamins and minerals early on in my career. And I wrote a book, about weight loss, about 30 years ago. And I realized that one of the weaknesses I had as a doctor was vitamins, minerals, phytonutrients, nutrition, because in medical school, we maybe got about a half hour to an hour throughout our entire training. I mean, we studied about the consequences of alcohol abuse, which is really a big factor in nutrition. But other than that, we didn't discuss, bioflavonoids or carotenoids or, all the things that proper nutrition brings to the table. So it was in the year 2000. I'll never forget it. It's 20 years ago. I started to study for the American College of Nutrition's exam to be a C.N.S. And I took the exam, but before I took it, I purchased their study package, and I got their books and their journal articles. And I got to tell you, Dr. Z, I spent about a year studying, about nutrition. And when I took the exam about 20 years ago, It was a 3-hour exam. There were people, I think I actually took it in Manhattan. I'm not sure. But it was at a major nutrition conference, and there were people there from all over the world taking the exam. And it was a tough exam. I mean, there were questions about maternal physiology, things I really didn't understand. There were obstetrical and gynecological questions and about iron metabolism and overzealous use of iron. I mean, I can remember there were subjects that I had very little information, but I remember studying for it so I can answer the questions. And when I became a C.N.S., then I started to write more books on nutrition and healing, and I actually became an alternative cardiologist, or I say I became a conventional cardiologist in recovery. When I started to use, a lot of these methodologies I learned from, my study, and then I applied it to my patients, and I saw a lot of, quote, miracles in my practice. So, I'm sure you understand this like any practitioner. Your patients are your best messengers. And when you try things in your patients where pharmaceutical support, some patients need pharmaceutical support, but let's face it, a lot of patients don't. And a lot of patients thrive on alternative methodologies when pharmaceutical support has sort of been a blind alley. So I hope I didn't talk too much about it, but that's sort of my background.
No, that's it's really amazing how, that kind of woke you up to this other reality that you have never really kind of maybe, or you were considering, but you didn't really make that leap of faith to actually use it in practice. And I'm sure you faced some heat about it too, because there's all so sort of people that walk the path, they tend to get some friction with some of the colleagues there. But anyway, let's talk a little bit about the heart itself. And why is the heart so responsive to nutrition? I mean, I guess people know the basics of the heart, that it's a very important muscle that never goes to sleep. It's like, we can rest our biceps and our triceps at night, but we can't rest our heart. So you would think that something so metabolically active would take so much nutrition of the body.
Yeah, great question. Actually, that's one of the reasons why I wrote the book Metabolic Cardiology years ago. The answer to that question probably lies in the mitochondria of our cells. Now, for your listeners, if they go back to high school biology, they remember that the mitochondria actually are little factories in our cells, and they produce the energy that we need to thrive. Now, the Chinese may call it chi or prana, or the Indians may call it prana, or the Hebrews breath of God. I mean, it goes on, but basically it's our ATP energy. It's our whole energy of our being. And we only have about 8 to 10 seconds of ATP. I mean, even the German war criminals knew this, in World War II, when I used cyanide. They realized that cyanide, when taken internally, would shut down the energy produced in factories in the body. We call that the Krebs cycle. And basically, it would shut it down immediately. And that's why cyanide would be, a quick death. And it's something to understand. So the heart, like you said, has more mitochondria. And the reason being, it's the most energetic organ, in the body, basically. So if we look at the biceps, for example, they may have only about 200 mitochondria per cell. If you look at a heart cell, they can have up to 5,000 mitochondria. And there's been different research on this over the years, but about 1/3 of the entire weight of the heart is based on mitochondria. So that's an amazing thought, that these organelles occupy 1/3 of the entire architecture of the heart. And the reason being, and you said it, the heart never stops. It beats, over 100,000 beats per day. It never rests. The only rest it has is, in between what we call systolic cycles, where the heart rests for a split second. And while it's filling with blood, but even there, it takes more ATP when the heart fills with blood than when we empty the heart. And ATP, remember, is energy. We call it adenosine triphosphate. So that's the story about mitochondria. And as a heart specialist, I just realized that supporting mitochondria was really the essence of treating the heart, particularly when it's ravaged by disease. Now, that could be longstanding hypertension, it could be plaque formation, it could be heavy metal intoxication, it could be viruses in the heart, it could be overzealous use of alcohol, infections in the heart, like rheumatic fever, for example. So whatever the pathology in the heart is, it doesn't matter. It doesn't matter. When the heart gets weakened by any pathology, we can use ATP support, and I call it metabolic cardiology. And I stumbled upon this, Dr. Z, over about, I would say 30 years or 3 decades when I was practicing cardiology on a day-to-day basis. I mean, I started to use coenzyme Q10 about almost 40 years ago. I started to use the carnitines maybe about 10 or 15 years after that. I wrote the book on carnitine in the heart. And then I was always using magnesium, even in my early days as a heart specialist, because sometimes we would be confronted with these horrible arrhythmias. We call it torsade de Pont, where you get what we call a reversible swinging ventricular tachycardia, which incidentally has been reported with the COVID-19 and hydroxychloroquine, sort of a rare complication. But when I was using magnesium on a day-to-day basis, and I combined it with coenzyme Q10 and carnitine, and then 20 years ago, a board-certified cardiologist from Ohio was lecturing in Las Vegas at the A4M, and I'm sitting in the audience, and he started to talk about ribose, D-ribose. And I'll never forget it, Dr. Z. I had this aha in my body because he gave me the answer I've been looking for. Because ribose is basically the ribose, what we call 5-sided purine ring, is the center of the ATP molecule. It's just amazing. So when I'm sitting in the audience and he's lecturing and I got it, I said, oh my God, that's the answer I've been looking for. So when I added ribose, D-ribose to my patients, taking coenzyme Q10 and the carnitines and magnesium, then I developed a magical formula that literally resurrected hearts. It's just incredible. I mean, I got to tell you, I mean, I've had so many people not go for heart transplant over, two decades. That has really been remarkable. I mean, one of the things I do when I go back to Connecticut, I see my pediatric population that refused heart transplantation when they're kids. Now they're all adults. And I see them just to see them in the office. I don't charge them anything. I just want to know how they're doing, because I'm learning more about metabolic cardiology, because the next phase of that is the resurrection of our own intrinsic stem cells, which I think is really the incredible discovery that somebody will link that dot to in the future.
What about, we're supposed to make these amino acids. Carnitine is made out of methionine and lysine. And of course, ATP, you have all kinds of other amino acids and B vitamins and things like that feed into these types of things. So these are like what they call conditionally essential amino acids. The way I teach my students is that there's a lot of things that steal methionine out of the body. Methionine is very important for liver detoxification of chemicals and things like that. So if you're stealing from Peter, what's the saying? Robbing from Peter to pay Paul.
Paul, yeah.
Right? You're limiting your amount of methionine. And then I think that there's, it's not just methionine, but you need to activate the methionine and make SAMe, that activated methionine, to kind of make carnitine. So it's interesting that we use these as nutrients. Our body can make them, but I guess why do we run out of these nutrients, you think?
Well, one of the reasons is You're absolutely correct. Our body does make them, but then we have overutilization of the nutrients. In other words, they are being used up so quickly. Let me give you an example. I've done about 30,000 stress tests, exercise treadmill evaluations in my career as a cardiologist. And I'll never forget one case because, it's amazing, Dr. Z. One particular case can change your direction for the rest of your life and your practice. I mean, again, these patients can be a real messenger for other patients. And that's how we learn as doctors. And I remember I had a guy in his mid-40s. He had bypass surgery in his early 40s. And he had an exercise stress test. He did okay. And about 5 years after his bypass, he came back to me and he said he was having some symptoms again. And I said, okay, let's do an exercise test on you and find out. And he says, geez, I wish you wouldn't do that. I go, why? He goes, well, the last time you did that, I was so weak for a few days. I really was, I literally almost couldn't get out of bed. I said, really? I never heard of that before. And when he told me that information, I researched it, and I realized that in vulnerable hearts where you have overutilization of these substrates that form ATP through exercise, or basically if you're having angina or as a heart cramp, for example. And that's what he had. When you have overutilization, then you can, and if the body can't make it back fast enough, then he can develop symptomology. And that's why he said to me, I wish you wouldn't do this test, because I had dreadful fatigue. And this dreadful fatigue was a sign that he couldn't make back the CoQ10 fast enough. So he gave me that information, and I did a walking stress test on him. I took him real slow. And sure enough, I saw his ST segments displacements on his EKG drop. And I said, how are you feeling? And he goes, I don't have chest pain. I don't have shortness of breath, but I'm weaker and weaker. And then I realized that this was a cardiac symptom because his EKG was telling the truth. So I stopped the treadmill at a very early stage. And at that time, since I was wiser, then I replenished him with Ribose and additional CoQ10 and magnesium. And he didn't have the dreadful fatigue, and he didn't develop, any shortness of breath, or, he was fine. So what he taught me was this, is that when we overutilize these energy substrates in our body, and if our body can't make it back fast enough, we can be symptomatic. Now, in women who have hypertension or mitral valve prolapse, we call this diastolic dysfunction. In other words, they utilize more energy when the heart's filling with blood during diastole, as opposed when the heart is ejecting out blood. And we see this in hypertension, for example, in both men and women, where we can get diastolic dysfunction, where the coronaries are totally normal. So there are many factors out there that can deplete our energy reserves in the body. And that's why some women or men with mitral valve prolapse, they report fatigue or shortness of breath or atypical chest pain, because again, there's an overutilization, and the body cannot make back the energy substrates fast enough. So that was the whole basis for metabolic cardiology. And that's why I used it more and more in my practice, because I was more of a biochemist than a cardiologist. I was treating chemistry as opposed to physiology, which, I would get down to the brass tacks of the situation.
Well, that's kind of how, how we gain an understanding, is to understand the nutrition and biochemistry. I mean, if nutrients and herbs work, which they have for thousands of years, there has to be some reason for it. So it's great that you're getting it such in depth like that, and wonderful. Moving on to hardening of the arteries, that's kind of an interesting phenomenon. I've been running the OX-LDL profile of the lipids. Tell us a little bit about your book, The Cholesterol Myth, in a few minutes, because we live in a time when so many people are on Lipitor and other drugs, yet it doesn't seem to be successfully kind of roto-rootering the arteries and cleaning them out. What's the big disconnect here?
Oh boy, that's a huge question, and I spent years agonizing over the cholesterol myth. Let me put it this way, Dr. Z. When I was chief of cardiology at my institution, I believed in the cholesterol theory of heart disease. I absolutely bought it hook, line, and sinker. Then in 1997, there was an article I read actually it came out of India, where it talked about statins, how they deplete coenzyme Q10 in the myocardial cells of the heart. And this really disturbed me because, again, I've done so much research on coenzyme Q10. I started to use it, and I would say the early 80s. So I had about a 15-year experience with CoQ10. And I immediately asked a rhetorical question, well, how can a drug that allegedly is supposed to help rescue the heart be so toxic to the heart at the same time, because it depletes the one nutrient that is so important for cardiac function? So what I did is one of the journals, I used to do a lot of peer review on the journals, but one of the journals asked me to write an article about statins and cholesterol. And I told them I would do it. And I'll tell you, Dr. Z, it was one of the most difficult things I've ever did because I had to spend hours and hours researching the conventional literature at the time, and these early statin studies. And this went into the late 90s. And I have to tell you that the confusion out there was incredible. And a lot of the papers I thought were fudged in a way. They were talking about relative risk, not absolute risk. And then I realized that a lot of the stuff on the statins was misconstrued. But I will tell you one thing. There was one paper that came out in Scotland. We call it the West of Scotland study. I thought that was the most amazing paper on statins, where they took these Scottish men. They were very, very high risk. They were smoking 2 packs a day. They had high cholesterols. They were just a mess in a way for cardiovascular prevention. And the research has demonstrated that what statins did, and these patients who were on the statins had better results than the people not on statins. And what the researchers suggested, that the statins had their efficacy in these high-risk Scottish smoking men had nothing to do with cholesterol. Basically, what they said, it had to do with blood rheology, meaning that statins were changing the shape of red blood cells when they go through the spleen and liver. And they said that statins had an impact on blood coagulation, in other words, blood thinning.
Wow.
And I realized for the first time that, oh my gosh, the drug companies can't sell that to patients. It's too complicated. The shape of red blood cells going through the spleen, the antioxidant potential, the blood thinning of statins. But cholesterol, they could sell. And I realized that after I went through this arduous task, and I reported this, I did an editorial for one of the major journals. And I realized that at that time, when I was chief of cardiology, lecturing on the benefits of statins, I did a completely 100-degree turnaround. I told Merck and Pfizer and the pharmaceuticals, I'm sorry, I cannot lecture for you anymore. I just do not believe in the efficacy of statins. But in my research on CoQ10 and grounding and statins, I realized that a low-dose statin, a very low-dose statin, because, again, of the West of Scotland studies and some other studies showed this antioxidant effect, I realized that in men under the age of 75, and I used my own clinical experience, was that statins did have an advantage. Now, do they have an advantage in women? Not so much. I realized that statins had too much excess baggage in women, too many side effects, and I would only use them very rarely, only in women who are developing recurrent heart disease despite surgical therapies, pharmaceutical therapies, etc. Younger men with coronary disease under the age of 75. I thought a low-dose statin with coenzyme Q10 at the same time did have an advantage. So even right now, if I had a 45-year-old male or a 60-year-old male with coronary artery disease, or let's say a previous heart attack, a coronary calcification by these specialized beam computerized tomography machines, if I showed that there was coronary calcification, a previous heart attack, I would use a low-dose statin and give coenzyme Q10 at the same time to these individuals, because I do think there is an advantage. And that's what the great cholesterol myth is about. There are so many aspects. And the problem in this country is there's so many people taking statins that I think don't need to be on statins. And what we have to focus on is the people where statins have the greatest advantage with the least side effects. And that's where, as physicians, we should try to come together and support, that population. The greatest at risk with the least side effects, and then give them a low-dose statin going forward.
What about the oxidation of the LDL and the oxy LDL markers? That's pretty important, I think.
Yeah. In other words, if your LDL doesn't oxidize, I mean, who cares? Because it's really oxidized LDL. That's the whole sequence of endothelial cell dysfunction and macrophage and the whole lining down of plaque formation, which is really inflammation. And let's face it, it's an inflammatory response in the inner basement membrane of the arteries lining. So the secret here is if the LDL does not oxidize, then it's less virulent to the inner basement membrane. And it's interesting, one of the functions of coenzyme Q10 is that it helps to prevent the oxidation of LDL. And when I learned about that, I think I was in my early 50s or late 50s, I doubled up on my coenzyme Q10. I've been taking coenzyme Q10 for decades. I mean, because as a heart specialist, I feel that preventing the oxidation of LDL is crucial. And it's important going forward. And then there's the Lp(a) story, which I think is the real cholesterol story, Dr. Z.
Yeah. What about like a lot of the botanicals and the polyphenols? They work as powerful antioxidants, and they've been shown to protect the inside of your heart. The way I explained it to people is like the heart gets attacked by these, free radicals, and it causes like a crack. It's almost like if you're spackling your house before you paint, you get a crack in the wall, you put some spackle there, but you don't sand over it, and but you have to prevent the cracks. And cholesterol's like the putty that comes in there to try to fill in the cracks in a way. And it's a simple way to explain it to patients, but so you have to not stop the putty, you have to stop the cracks from forming.
Right. I mean, Johnny Bowden has that's a good metaphor, and Johnny Bowden has a metaphor about firemen going to a fire. Same thing. Oh,
yeah. That's a good one. Yeah, you don't kill the firemen, right?
Right. And the great cholesterol myth, but I mean, one of the things that, statins do, like I mentioned before, they do have an antioxidant effect, and that blood thinning effect, again, I think is crucial, because I think one of the biggest problematic situations we have, in the post-Framingham, era, like we're both from Connecticut, the Framingham data is still coming in, and a lot of cardiologists were so disturbed with the data, because what they realized was that the patients with the highest cholesterols were living the longest. And this was something that was totally contrary to their beliefs. And, the Framingham data, I mean, it started in, I think, the late 40s or early 50s. And there's still people surviving. And again, cholesterol, high cholesterol is not a death sentence that we thought it was. But LP little a now, that small cholesterol particle with a disulfide bridge is highly inflammatory, Dr. Z, and it's highly what we call thrombotic, meaning that it makes the blood stick even more. So I think sticky blood is, or hypercoagulable blood, is a major risk factor going forward in the 21st century. And that's why I really endorse grounding, because when we found that earthing and grounding thins the blood, that's what we need to do in the prevention of atherosclerosis and inflammatory heart disease.
Right. And I always tell patients that there's many parameters for thick blood. You have your fibrinogen makes it thick. Sometimes it's excess sugar that makes it thick.
Yes.
Then, of course, you can have too many red blood cells. Dehydration, chronic dehydration makes your blood thick too. And then, of course, lipids could make it thick, and there's probably a plethora of other reasons for why the blood can be thick.
Well, smoking too. I mean, when you pollute the blood with nicotine and carbon monoxide, that thickens the blood as well. And no, you said it. There's so many things that we put in our body. I mean, look at the heavy metal situation, the insecticides, pesticides, the GMO foods. All this stuff causes inflammation and sticky blood at the same time. So hypercoagulable blood, I think, is one of the major reasons why we're seeing, more cardiac events in people. And this whole thing about COVID-19 is sort of connected because, what we're seeing there is blood clots in the lung.
Right.
And so, I think this 21st century period we're living in this toxic environment and the wireless and all the, oh my God, whether it's the computerized age or the chemical age, I mean, there's something going on in the environment that's changing the physiology and the electromagnetic mobility of our bloodstream, where it's making us more vulnerable to stroke and heart disease and heart attack and heart failure and all these entities where that thick hypercoagulable blood can produce pathology in the body.
That's a great segue. So we'll take a quick break and play our natural medicine chest little mini module. And when we return, we'll talk about this coagulability of the blood and more about COVID-19 and its cardiac implications with renowned cardiologist Dr. Stephen Sinatra. Stay with us, folks.
On this edition of the Natural Medicine Chest, we'll discuss Sarsaparilla, or Smilax officinalis.
Sarsaparilla is a tropical plant which grows in South America, Mexico, and Guatemala. Although most Americans are familiar with it as a flavor enhancer for root beer, it has also been used for its beneficial properties for hundreds of years by many different cultures. In Roman times, the young shoots were eaten, and the mature vines were worn as garlands at festivals of Bacchus. According to ancient Roman writings, Sarsaparilla originated when the beautiful maiden Smilax was turned into a shrub after her love was slighted by the young crocus.
Sarsaparilla was brought to Europe in the 16th century by Spanish traders. A French physician, Nicolas Monardus, published a comprehensive account of sarsaparilla as a treatment for syphilis in 1574. During Portuguese military operations in 1812, a British Inspector General of Hospitals noted its positive effect on syphilis patients. It has also been used in China for treatment of the same condition. Sarsaparilla was included in the United States Pharmacopoeia until 1950 as a recommended treatment of secondary syphilis.
Sarsaparilla's medicinal action appears to be a result of binding bacterial endotoxins in the gut, thereby decreasing their absorption. This greatly reduces the stress on the liver and is likely responsible for its historic use as a tonic and blood purifier.
In a controlled study of 92 patients published in the New England Journal of Medicine in 1942, A chemically active component of Sarsaparilla, called Sarsaparilla, greatly improved psoriasis in 62% of the patients and resulted in complete clearance in 18%. Sarsaparilla is often recommended by naturopathic physicians for gout, arthritis, and psoriasis. Another folkloric use for Sarsaparilla is as a tonic for male sexual potency.
So, if you want a root beer flavored tea with a long history as a healthy tonic, reach for the Sarsaparilla in your natural medicine chest.
Of the Natural Nurse and Dr. Z, I'm Dr. Z, Dr. Eugene Zampro, naturopathic physician and registered herbalist and founder of the University of Bridgeport Naturopathic Medical School. And we're with Dr. Stephen Sinatra, highly respected and sought after cardiologist, integrated cardiologist, and we're having a wonderful high-level conversation. Hope you're keeping up with us, folks. So, Dr. Sinatra, before we left, we were talking about the bioenergetic issues affecting circulation. Tell us a little bit about how you got interested in bioenergetic medicine and grounding or earthing and its effect on the heart, and then we'll segue into COVID.
Sure. That provocative question is amazing because there's so many answers to it, but the main answer is this. I was at an American College of Cardiology conference about 15 years ago on the West Coast, and I met Clint Ober. For some reason, I guess he sought me out, and he was a cowboy from Montana, so to speak. And he introduced the concept of earthing and grounding to me. And I'll tell you, Dr. Z, it made a lot of sense. It was just amazing. But I said to him, I said, look, if you can do research and show that grounding has an ability to thin the blood or has an ability to have an antioxidant effect, and you produce research to show that it can, lower blood pressure, have an effect on cardiac risk factors, so to speak, I'm all in, And it's amazing, but since that time, almost 15 years ago, there's been about 25 to 30 published papers in the medical literature, and now grounding is going into textbooks of cardiology and et cetera, et cetera. But over that period of time, it is absolutely convincing that grounding or bringing the Schumann effect of the Earth's potential. And now what the Schumann energy is this. When the Earth is struck by lightning, especially around the equator, there's maybe 1,000 to 2,000 lightning strikes per minute around the equator. The Earth is endowed with electrons, and a lot of these electrons can come from sunspots as well, or explosions on the sun, and they travel through the stratosphere and stuff like that out in space, and they hit the Earth. These electrons, when taken into our body by walking barefoot, and the best place to walk barefoot would be like the ocean, an example. In other words, when the tide's coming in and you're hitting the sand and it's in that wet area, there's great conductivity. But, if somebody had a house that was built on stone or dirt, or they use concrete but not wood for their floors, that would be grounded as well, and I've had people call me where they want a grounded bathroom or a grounded kitchen, and I have them get in touch with Clint Ober because he speaks to architects about this. And the reason why this is so incredible is that when we take in the Mother Earth energy, and the papers on this are phenomenal, what's happening is we're balancing out the overdriven, what we call sympathetic nervous system. Because let's face it, today, a lot of us are living in fear. We're living in anxiety. I mean, look what's happening in the country right now. I mean, it's just horrible with the rioting and the looting and the just distrust of government. And there's so many things going on where people have vigilance and fear and are waiting for the other shoe to drop. Well, this excites the autonomic nervous system. And this in itself is a dangerous situation because it has an effect on what we call heart rate variability. And whenever heart rate variability is disturbed, we see more heart attack, we see more sudden death. And that's why even in a situation where people are staying indoors and everything else, we're seeing more cardiac-related situations because heart rate variability is disturbed. I know this seems very complicated, but to a heart specialist like myself, it's very simple, because what we need to do is we need to bring back Mother Earth to the equation. So when we put our bare feet on the ground, on grass, on concrete, on brick, you're in Connecticut right now. It's springtime, and if you go outside and just put your bare feet on the ground, you'll be assimilating the Schumann effect, we call 7.38 hertz, and it's like taking antioxidants at the same time. But now you're absorbing the energy through your feet, and you're an acupuncture guy, right, or an herbalist. I mean, it's the K1, it's the K1 which connects the whole body into the brain, into the pineal gland. So now you're taking in this Mother Earth energy, and now you're balancing out the overstressed autonomic nervous system, and you're balancing out cortisol, you're thinning the blood, you're improving heart rate variability. That's the research I did on earthing and grounding with the HRV as well as the thinning of the blood. So I just feel that grounding brings an enormous amount to the table in getting us better, or creating more wellness in our bodies in this toxic environment that we're living in.
So do people have to do meditation when they're grounding, or do they just walk outside? Is it that simple?
It's that simple. Now, if they want to do a walk-in meditation, that's okay. If they want to sit with their bare feet on the ground and say a prayer or meditate or use a mantra, I mean, any of that's fine. In other words, any way you quiet down the autonomic nervous system, because when that's in overdrive, that's when we see hypertension, cardiac arrhythmias, heart attack, sudden cardiac death. Again, it has to do with disturbed heart rate variability. And we know now that the impact on earthing in the heart, not only does it stabilize, the overstressed heart. In other words, it supports heart rate variability, but it thins the blood at the same time. And I got to tell you, Dr. Z, when I did the research where we showed that earthing thinned the blood, I'm a reviewer for a lot of journals. I mean, I review the American Journal of Cardiology, Circulation. I mean, articles are sent to me where I do peer review. And when I did this research, I said to myself, oh my God, my two greatest discoveries in almost 50 years of medicine has been the use of coenzyme Q10 in my patients and the value of earthing, what it brings to the body. And they're both kind of connected because they both support ATP. You know what I mean? They both support, right, our chi energy, right? So there's the connection. And these are the two greatest discoveries I've ever made in my lifetime. So when I wrote the paper on earthing and grounding and thinning the blood, I thought this was like, I mean, I don't want to sound pompous, but I said, oh my God, this is like Nobel Prize material. And I said, this is the greatest paper I've ever written. Well, guess what? I sent this to the 7 top journals in the world. They all turned me down.
Yeah, and, exactly.
It was amazing. Have you ever heard of Ali Johansson from Sweden?
Yes.
Well, Ali calls me up, and he said to me, he goes, he's laughing about this. I said, Ali, what are you laughing about? I mean, this is the greatest research I've ever done. He goes, you know what? You'll be dead and buried, and they may offer your entire group the Nobel Prize, but nobody's going to believe you.
Yeah, it's like flat Earth medicine, folks,
Yeah. Is the Earth flat or round? You know what I mean?
Right, exactly.
So he was laughing about this, and I guess it makes a lot of sense because I get great discoveries in medicine need to be laughed at first. So
well, it's interesting, Doc. Many of the old naturopaths back in the day, they cured people of tuberculosis using hydrotherapy. This is like Father Kniep and some of the great Benedict Luce, some of the founders of naturopathic medicine. There was a huge hydropathic movement in Germany that came over and founded naturopathic medicine back in the 1800s or so. And they were using natural things like walking barefoot, There was a guy named Dr. Rickley
Right.
who was who believed in, they called him the sunshine barefoot doctor. And so these pioneers, they didn't know why it worked. They just knew it worked. You're here giving us the physiology and also the physics behind it, which is fabulous. But just because things work doesn't mean it's going to be accepted. I always think of Dr. Papanikolaou, who was spurned, and Ignaz Semmelweis, who believed in sterilizing equipment between childbirth, and his residents were denied residency if they believed in the Semmelweis method. And all he did was sterilize his equipment between things. So things that seem absurd in today's lens of like of course we would sterilize equipment. Look what we're doing with COVID. We're sterilizing everything. People were laughed at that time. So you'll get the Nobel Prize one day, Doc.
Oh, I don't know. I mean, I could care less about that, but it's just that, I've been a doctor for almost 5 decades. And, when you discover something like that can really help people. Let me give you an example, Dr. Z. If I was practicing in the office, and let's say you called me and said, "Hey, Doc, I'm having chest pain, and I think I'm having a heart attack. I mean, I have a crushing sensation in my chest. There's an elephant standing on me." You know what I would say to him now? I would say, call a 911,
right,
chew on a baby aspirin or a whole aspirin, and go outside, wait for the ambulance, and put your bare feet on the grass. That's what I would tell him right now, because what we learned in our research was that, and this is why an aspirin is so crucial in, let's say, the early stage of a heart attack. Because remember, most of these heart attacks are caused by sticky blood, or red ketchup blood that clots. And if you can open up the clot, let's say with an aspirin, or with earthing and grounding, then, the heart attack symptoms can wax and wane, where, you open up the blood vessel, the patient immediately feels better. Then all of a sudden the blood vessel closes again and they get recurrent symptoms. But at least if you're reperfusing the starving heart with oxygen, this gives you a better chance having a stent or an angioplasty. Because remember, the earlier you have that intervention, and hopefully it's within an hour of symptoms, well, then you can resurrect the whole myocardium. You don't get any damage. And that's the wonder of bringing, such earthing to the table and stuff like that, where, you can get to mainstream medicine, where mainstream medicine can fix you and reverse the entire process.
So we wanted to spend a few minutes on COVID here before the tail end of the program here. So you're saying that the COVID thing that's happening certainly creates a lot of cardiac issues and coagulopathies that we're seeing.
Yeah, I've been doing radio on COVID and TV for the last couple of months, and one thing I'm sure you're aware of, and our listeners are aware of, that COVID is changing from day to day. We are learning almost daily about COVID. Now, when this first wave goes away, and we're thinking that it'll probably go away probably in July through most of the country. It may come back again in the fall, because any influenza virus is redundant because of cold weather and stuff like that. That's why down here in Florida we have less cases, which is because it's the cold weather that propagates the virus. Remember, if it's hard for the virus to live in hot, humid areas. But having said that, one of the most important things that I could say about this COVID virus that I've learned is that it does affect the heart. In other words, it's inhaled, and we think a lot of it has to do with the ACE2 receptor in the lung. But basically, when it's inhaled, it can be delivered to the myocardium, because the pulmonary circulation and the cardiovascular circulation share similar blood vessels, and what affects the heart can affect the lung. Now, in China, where the COVID started, the Chinese reported in the medical literature a couple of months ago that in a small section of, let's say, 420 patients at Wuhan, where it started, about 19% of these patients developed what we call myocarditis, meaning that when these patients survive the respiratory illness, about 1/5 of them now develop cardiac symptoms, demonstrating that this virus has an impact on myocardial cells and respiratory cells. Now, the good news is that a lot of these people with myocardial involvement would get better on their own, but some of them didn't. So what we're learning is that some of these patients, they could go into heart failure, they could gain a little weight, swelling of the ankles, getting a little shortness of breath. So my plea to you and to our listeners is that if you did develop a viral infection, whether it's COVID-19 or whether it's another respiratory virus, and you develop symptoms that are cardiac related, dreadful fatigue, for example, the shortness of breath, the ankle swelling, we call it PND. At night when you're laying down, you're having more cough and shortness of breath. This could signify cardiac involvement where you need to go see your heart specialist or your internist or your naturopath, and they can refer you for an echocardiogram to see that your cardiac system is involved or not involved. So this coronavirus is something that is much more toxic than we think it is, because it has a propensity for not only the lung, but also it's causing what we call endothelial cell damage in the vessels of our blood vessels. And again, we have blood vessels, the virus doesn't care whether it's a blood vessel in your arm or in your GI tract or in your brain or in your heart. It attacks these endothelial lining of the blood vessels, and it creates a very potent inflammatory response. So could the coronavirus be a blood vessel disease? Yeah, it could be. And I think the research is going to tease that out as we go down the road.
So folks with pre-existing heart issues, it certainly is more of a concern than folks that don't have these type of comorbidities.
Exactly. In other words, you're absolutely right, Dr. Z. Let's talk about the comorbidities. An aging male, for example, is behind the eight ball, and any male over the age of 65 or 70 is more vulnerable to this. African American population more vulnerable. This is coming out. Anybody with high blood pressure is more vulnerable because of diastolic dysfunction. I mentioned a little bit that earlier in the broadcast. Anyone with diabetes. I mean, this is a very crucial, and I did podcasts on this in the past, for Healthy Directions. But anybody with diabetes, remember this, Dr. Z, and I'm sure you're privy to this information, that the heavier you are, the more obese you are. And a lot of these type 2 diabetics, they do have overweight status, and that's why they're rendered diabetic, because basically the overweight status creates a lot of inflammation in the body. We call it cytokines, where these are inflammatory messengers that live in fat cells. Right. Now, if you can take away the fat cells by, let's say, eating less carbohydrates, doing more walking, using COVID-19 as a stimulus to get more outside, and using it as a way of reducing weight, I think weight reduction in a type 2 diabetic could be miraculous in helping them lose their comorbidity and lose their vulnerability in succumbing or getting the virus. Because these type 2 diabetics, they're like, aging males that, they have a comorbidity. And so it's almost like the perfect storm. You take an aging male or an aging female with type 2 diabetes and hypertension at the same time, well, then they have so many comorbidities that they could succumb to the virus. So my plea to your listeners is if you have any comorbidity, try to fix the comorbidity or neutralize it so your immune system is stronger going forward to face the ravages of the virus.
Yeah, I mean, there's so many things that we're finding that helps our immune system. The politics of it is, we can't say these things publicly. I mean, we could say them on radio, but when we start advertising in our office, hey, come in and, do some things to help your immune system, then you get a letter from the F.A.C.C, which they've already sent to many people. I've actually seen some of the letters. So it's kind of, I like your idea of just cleaning house, taking care of your own house, your own soil, like the old time naturopaths used to call it, getting the soil. I'm out doing some gardening now that it's warmer, getting my soil really healthy, so that my vegetables are wonderful. It's the same thing inside with our own body.
Oh, you're absolutely right. I mean, I think people that put their hands in the gardening and taking in some of these pathogens in the soil and the grounding at the same time, by the way, so they're getting an additional effect. But I think it strengthens the immune system. And, my son Drew was a big proponent of that. By the way, I don't know if you know this, but my son's a naturopath. He went to Bastille.
Is that right? That's my alma mater. Really?
Yeah. Oh, really? You went to Bastille as well?
Yeah, I graduated. I'm celebrating 30 years out this June.
Oh, my gosh. You know what? You should have him on your program. You're both Bastille grads. I mean, he does a lot of work with digestive enzymes. I mean, he does a lot of work with Lyme disease, and
I'd love to have him on. We'll contact him.
Oh my God, 2 naturopaths like yourselves. Oh my, 2 Bastille grads. Let's see. What are you, about 50, Dr. Z?
Almost 60.
Almost 60. Yeah, he's going to be 40. So he started very early, In fact, it was amazing. I got to tell you this quick story. He was doing some audio visual for me when I was director of medical education. He was in high school, right? And he came to one of my lectures, and he said to me after the lecture, he goes, "Dad, I don't want to be a doctor." I go, "Why?" He goes, "Because they're all sad and angry." Now, this is like a 17-year-old kid taking this in. I go, "Okay, Drew, whatever you want to do." I mean, he went to college, and then in the middle of college, I said to him, "Drew, if you don't want to be a doctor, why don't you become a naturopath?" And, we took some of the pre-med courses, and he got into Bastille very, very quickly. But I think he was one of the young. He was only 21 when he got into Bastille. I mean, he was very young. Yeah. So that's great. You're both naturopaths. And I'll tell you, Dr. Z, he teaches me a lot. I mean, I'm blessed that I have him in my path because,
wonderful.
You guys bring a lot to the table. And I hope our listeners appreciate that. I mean, I think naturopaths, I've often thought, a naturopath and an MD take the same courses for the first 2 years of school. I mean, they're identical. You know what I mean? And I always thought that if you were an MD-ND combination, that would be the greatest healer of all time, because the Achilles heel of the MD is they're not involved in alternative or natural medicine. They're pharmaceutically based. But the Achilles heel of the ND is, they're not in the CCUs, ICUs, ERs, and, they don't see emergency medicine the way the MD does it.
Yeah.
So wouldn't it be nice if you can combine both worlds? What a healer you would be. You could take your acute, chronic, you name it. You know what I mean?
That would be it, certainly. So how can our listeners get in touch with you, Dr. Sinatra?
Oh, there's drsinatra.com. That's where vitamins and minerals. I have my healthy food website. That's vervana.com, VERVANA. I have a healthy site for pets, agelesspaws.com. Dr. Z, I've used coenzyme Q10 for years, and even in my pets, and I realized my dogs outlived their counterparts by 2 or 3 years using coenzyme Q10 because, again, coenzyme Q10 is one of the most important substances for preventing cardiomyopathy, which is weakening of the heart muscle, which is the demise of many dogs. We call it old age, but it's really, cardiac dysfunction. So
it's chi and prana in a bottle, so to speak.
Oh, interesting. That's a good way of saying that. ATP support in a bottle. That's right.
Exactly. Well, it's been great having you on the show, Dr. Sinatra. It was a great program. I really enjoy meeting you again, and I look forward to seeing you at a conference one day. I'll stop by and shake your hand.
Yeah, introduce yourself. And like I said, if you want to get in touch with me, just get in touch with me. And Drew would be a great person on your show. I mean, I'd like to listen to have you two naturopaths have a conversation.
And that does it for another edition of The Natural Nurse and Dr. Z. This is Dr. Z saying, stay healthy, folks. Health is wealth. Bye-bye, and see you next week.